Today I'm going to speak about child abuse. But first of all, we need to know what is child abuse. Child abuse is harming a child physically, psychologically, sexually, or by neglect. Now we're gonna talk about child abuse effects. Attachment and interpersonal relationship problems. Developmental problems. Child suicide, alcohol and drugs use. Criminal activities and homelessness. Explanation for child manipulation. The remoteness of the abuser in his childhood. Psychological and mental disorder of the abuser. Lack of parental skills. The abuser could be alcoholic or drugs addicted. The abuser was once a victim of child maltreatment in his childhood. Hannah was born April 9th of 1999. When she approached 2 years old, her parents separated, and after a while it was noticed hair pulled out, bruising in odd places, and that 2 years old child wouldn't normally be bruised that way just because a fall, as the abuser said. Who do you think is the abuser?
Hannah was born April 9th of 1999. It's our youngest son's daughter. Her parents became separated. We noticed hair pulled out, bruising in odd places where a 2-year-old child wouldn't normally be bruised just from a fall. We were told she fell off some playground equipment and fractured her wrist. Not too long, she was in the hospital for her face and neck and shoulder was all bruised. She was very lethargic. She was throwing up. The birth mother had told the ER staff that she had fallen off playground equipment again. It was apparent to me that it wasn't a fall. I was very concerned about it. I went back out in the emergency room, the reception desk, and I quietly asked her, I said, I do not believe this was an accident. I said, what can be done about this? And all I got from her was an 800 number for CPS, and she told me if I have any concerns to call that number and talk to them about it. 10 days after I had called CPS, Joanne, my wife, got a call. It was too late. She's down here in the hospital. You needed to come down to the emergency room. We were met with a Child Protective Services worker and a police detective, and they told us that Hannah had been shaken.
There was this little baby that I took care of in the operating room about 2 years ago that was about 15 months old, and he had been abused by a member of his family. And I couldn't help but look at him and think of my own little children that were about the same age at the time, and imagine if they had been beaten like that and if they had suffered like that without anyone looking out for them. I couldn't imagine another child going through that sort of circumstance without someone standing between them and the person that was hurting them like that. And I promised that little baby that even though I couldn't save him in that moment, that if there was another little baby that I could help, that I would.
The care team was actually started in 1994, primarily just seeing victims of sexual abuse and doing those medical evaluations. I think the first year they saw around 300 children, then we expanded. We started seeing more and more of the physical abuse cases. Now we see just in care team around 1,400 children a year. We've grown exponentially, and we'd like to stop growing.
When little children come in with injuries like that, the fatal injuries, they often have a previous injury that was either missed or not reported in a medical setting. And so I thought that since I hadn't received much education on the topic, that maybe others in other specialties and pediatricians maybe hadn't received as much education as is necessary on child abuse and neglect.
Dr. Daly came to me over a year ago wanting to do an education program and asked what my opinion was and if I would help her and help back it. And I was like, absolutely, that sounds like a wonderful idea. And so that's how it all started. And it just exploded.
As we spoke to people, everyone was so supportive and interested in learning more about it. And I thought, well, maybe instead of just asking for something like an improved screening question, maybe we should start a center for prevention of child maltreatment. And I came up with a proposal, and there hasn't been one level of the administration inside of Cook Children's that hasn't been overwhelmingly, completely supportive of the project. The Center for Prevention of Child Maltreatment is part of the Center for Children's Health, which is under the corporate structure of the Cook Children's healthcare system, whereas the care team is part of the medical center. The word maltreatment includes abuse, neglect, sexual abuse, physical abuse, bullying, sex trafficking, all of the different types of abuse and neglect that may occur with children. The difference between our center and other areas inside the medical center, like the care team that care for children that come in and have already been abused, our focus is on primary prevention and some secondary prevention as well. Our goal is to get upstream of the problem and to stop the abuse before it starts.
It's through the center that we already are learning so much about our community resources and what's available and what's not available. And through the center, we're looking at groundbreaking research to evaluate and try to predict when abuse or where abuse may happen so that we can step in beforehand with resources for those families that they so desperately need.
We've identified a series of risk factors that are known in the literature and research by places like the Centers for Disease Control and the National Institute of Health, and also protective factors, things that might inhibit child maltreatment from occurring. And we're looking to see where these things exist in the community on as small of a level as we can, and looking to see what resources are available so that we can all learn together ways to create a community that will help to support safe families and children that are being brought up in a way that encourages their growth and their health instead of damaging them. In Texas, about 80% of children that die from child maltreatment are 0 to 3 years old. There are lots of temper tantrums and developmental changes, and they don't necessarily respond to reason. Sometimes babies can cry up to 5 hours a day for no reason at all, and it's completely normal. And so people can get really frustrated with little children. They can't speak out for themselves. Often they don't even know that what's happening to them is wrong. So there's safety in that a little for the abuser. And those kids aren't in school. A lot of times they're not in church or in daycare. They may not go for very many preventive medical appointments.
The majority of abuse is neglect. And I would say that most of those children never go to a medical provider because there's not actual injuries or physical things that seem to warrant a physical exam.
We only have a small window of opportunity to notice these kids when they do come into a medical setting, and we may be the only people that have the amount of information that's necessary to establish risk. It is incredibly important for all of us to know that the burden for that discovery is on us, because we may be the only ones that examine that child before they come in with a serious injury.
If abuse is perceived and recognized, not only how do we keep it from happening again, but how do we help that child heal? The majority of the children, we can fix their physical injuries, but the emotional is a lot more difficult.
She's now 15 and a half and doing well. Mentally, she's around 5 or 6 year old level. There's not much hope of her getting much past that level. It's a life sentence for her for this few seconds of thoughtlessness. You have to keep an eye on her 24/7, and that leaves you no time to do what you want to do or thought you could do someday. She's the first victim serving a life sentence, but it's done the same thing to a lot of other people. A lot of people have been impacted by her abuse.
What would Hannah have been? What would she have contributed to society if she hadn't been injured? You can't measure that. The center is essential for our community and for the prevention of child abuse. Have every child reach their fullest potential.
My dream for this is to find a way to protect the kids that are dying. I don't ever want to see another little 15-month-old like that come through the OR and know that they suffered at the hands of their caregiver. To educate people, to see people work together to enrich the lives of the children around them, instead of following the path that these children follow now, which is illness and incarceration and violence and repetition of abuse when they become adults. I'd like to find a way to stop that so that we can have a healthy community with safe children.
Every child deserves to grow up feeling safe and loved. To do this, you have to talk to their imaginary friends and the real ones. Support their imaginations. Share information with them. Share your insight with them. Talk about their goals and dreams. Make sure they know that they can be whatever they want when they grow up.